Hello, everyone. Welcome to another review on auricular wellness. This time we focus on acupuncture channels and point categories. We are now on week 6, and today we shall try to hone our skills on the Jueyin channels. Okay, let's welcome Mom Trix. I hope we can do this fast.
Okay.
Mom Trix, what's the Jingluo name of the pericardium channel?
It's hand Yin.
Okay, can you tell us? Actually, you can see the picture there, no, the diagram. Can you somehow trace the pathway of the pericardium primary channel?
So it originates at the center of the chest and then connects with the pericardium. It also descends through the diaphragm to the
Yes.
abdomen, passing through the upper middle and the lower jaw, or a one branch channel pathway. It runs from the inside of the chest and emerges in the coastal region, treats soon, inferior to the axillary fold, and then arches over the axilla and follows along the anterior medial aspect of the arm between the lung and the heart channels. It also descends the forearm between the palmaris longus and flexor carpi radialis muscle to teach the palm. Travels from the palm along the middle finger to terminate at its tip, and another branch, it's an invisible pathway, arises from the palm at the pericardium 8 and follows the radial aspect of the ring finger to its tip.
Okay, thank you. Very well said. Number 3, between which two channels does the pericardium channel travel from the cubital crease to the hand?
The lung and the heart.
Which Zangfu organ does the PC channel connect with?
The sanjiao.
Okay, can you tell us the function uh, overview for the pericardium channel?
So it cools blood, clears heat and at the yin and the blood level. It opens the mind's orifices. It's connected with the uterus. It affects the shen.
Mhm.
Uh, affects the shen.
Yeah, yeah. Actually, when you deal with heart excess, no, we don't sedate the heart, but we can sedate the pericardium, no. So because there are, I'm sure you're very familiar with heart excess, heart deficiency, diba? So when you have heart excess, you, according to the book that I read, you don't sedate the heart, but you sedate the pericardium because the pericardium is the one that guards the heart. What are the 4 levels of heat disease?
Wei, qi, yin, and blood.
Okay. The channel, that's the my. Way, the skin. Okay, so you can also have heat on the channel, on the organ, the ing, and the blood. What is the pericardium called in TCM? How is it regarded as?
It's called the minister or the heart protector.
Okay, can you tell us the location and function of pericardium 1?
It's located one soon lateral and slightly superior to the nipple at the fourth intercostal space. And then the function is remove obstruction of chi flow in the Jueyin. There's chest tightness, restlessness, flank, hypochondriac pain.
Okay, yeah, for pain.
Mm.
Okay, pericardium 1 is located between which 2 points?
Stomach 17 and spleen 18.
Wow, memorize. What is the point category of PC1?
It's a window of the sky.
Okay, let's now go to pericardium 3. Location and function.
It's located on the transverse cubital crease in the depression immediately to the ulnar side of the biceps brachii muscle. The function, it harmonizes the stomach and intestines and stops vomiting, calms the mind for severe anxiety by heart fire, cardiac pain, palpitation, gastric pain.
Okay. You see, when you have heart fire, you treat the pericardium tree. Huh? Okay, what's the point category of PC3?
It's the Hussey point.
Okay, what are the three other points in
Uh,
like aligned with the pericardium 3? Of course, you have heart 3, diba? And what's the other one?
Lung 5 and
Oh, galing. Heart 3. Okay. Which point is pericardium 3? Ay, nandito na pala. Level win. And where is it? You just mentioned it.
it's the cubital crease.
Yeah. Lung 5 and heart 3. Okay, let's go to PC6, a very popular point. What is location and function?
The location is too soon, proximal to pericardium 7 from the wrist crease between the tendons of palmaris, longus, and flexor carpi radialis. The functions are to open the chest, thorax, and epigastrium, regulates chi and blood, calms the shen, harmonizes the stomach, and then nausea and vomiting.
Okay. What's the point category of pericardium 6?
The luo connecting of the pericardium, the opening point of the yin wei mai.
Okay. So, opening point. What's the coupled point of the yin wei mai? Pericardium 6 and spleen
Uh,
4. Diba? Memorized. Diba? Kasi pasyente ko kanina yan. Okay. Oh. Buti nagkataon. Okay. What's the opposite of PC6?
Sanjiao 5.
Great. Now let's go to PC7, location and function.
It's located at the wrist crease between tendons of palmaris longus and flexor carpi radialis. The functions are distal point for
The foot.
the
Yeah.
foot to calm the mind, clear the heart fire for manic depression, cardiac, flank and wrist pain, vomiting.
Yes. Sighting. No? This is very important, especially if you know balancing. No? What's the point category of PC7?
It's the shoe stream or the yuan source point.
Which points is PC7 in level with and where?
Uh, lung 9 and heart 7 at the wrist crease.
Okay, let's go to PC9, location and function.
The location is at the center of the tip of the middle finger. The functions are for tonification, clear heat for chronic mental symptoms, expel internal wind and restore consciousness, stroke with loss of consciousness, and heat stroke.
Great. Point category of pericardium 9.
It's a Jingwell.
What are the points of the Chongmai or penetrating vessel?
Kidney 11 to 21, and then Ren 7, stomach 30, and Ren 2.
Okay. If you have a patient, especially women, no? Um, when you're familiar with GERD, diba? When you have
Yes,
GERD,
sir.
and we all know that the Chongmai is related to the stomach, no? So this is so effective. Okay. There's a technique for locating kidney 11 to 21. First, you have to locate kidney 6, which is 0.5 soon from um, the REN 8. And then you go down, you go up. So that's 6 plus 5, 5 soon up. That's 7, 8, 9, 10, 11, and then 5 soon. I go down pala, sorry. 5, 6, yeah. 5, 6, 7, 8, 9. 6, 7, 8, 9, 10. Yeah. And then 21, 6. Okay. Ren 7. This is so effective. Chong Mai. So we shall also be reviewing Chong Mai. What are the opening points of Chong Mai?
Spleen 4 and pericardium 6.
Okay. You needle spleen 4 first on the right. If a woman, no, left, so pericardium 6 on the left. Okay. For the pericardium, it's a Jingwell, Yin Spring, Shoot Stream, Jin River, Hosi points of the pericardium channel.
It's PC9, PC8, 7, 5, and 3.
Okay, the pen horary point of the pericardium channel. So that means we're talking about the fire point of the fire the fire channel.
PC8.
Yes. Galing. Yuan source.
PC7,
Connecting.
PC6, and
Cheek
then
left.
the left is PC4.
Okay. Where does pericardium begin? Where does the pericardium channel begin?
The center of the chest.
Center?
And
Oo nga pala, center pala, sorry. Doon na pala naging one. What are the pericardium crossing points?
there are none.
Wow. Kala ko mo. What organs are entered by the pericardium channel?
The pericardium and the sanjiao.
What are the tissues associated with the pericardium channel?
The vessels which connects to the middle finger, medial elbow, axillary ribs, and diaphragm.
Okay. Okay. Name the pericardium pathologies.
Uh, Cardiac pain, palpitation, mental restlessness, stuffiness of the chest, flushed face, swelling in the axilla, depressive and manic mental disorders, spasms of the upper limbs, heat sensation in the palms.
Okay. Now, can you trace the luo channel of the pericardium?
So from pericardium 6 to the heart, it begins at pericardium 6, then ascends to the pericardium and connects with the heart, or yeah, the lower one.
Yeah, between the palmaris longus and flexor carpi radialis before connecting to the heart organ. Okay. What are the symptoms of pericardium luo deficiency?
Irritability and restlessness.
Okay, so now alam nyo na if you
Irritate.
if you're easily irritated, then you have to deal with the luo connecting of the pericardium. No? That's you have to tonify it, put more fire. Okay, what about pericardium luo excess or shu?
There's chest pain, cardiac pain, and angina pectoris.
Ano pipiliin mo, yung excess o yung deficiency?
Deficiency.
Okay. Now let's go to the sinew channel of the pericardium.
It disperses in the chest and binds at the diaphragm, disperses all over the anterior and posterior aspects of the ribs.
Okay. It starts at the tip of the middle finger, runs together with the lung sinew. So it's like side by side with the lung sinew channel. To bind at the medial side of the elbow, then goes to the upper arm to the axilla, where it binds before descending to disperse over the ribs. A branch enters the chest below the axilla and disperses in the chest and binds at the diaphragm. Okay, pathology of the pericardium sinew.
So it's an inverted cup sensation
Have you felt
below
that?
No. Below the lower right ribs,
Okay.
there's chest pain, stuffiness in the chest.
May bipolar ka na, meron ka pang inverted cup sensation. Can you imagine? Now, can you repeat wala pa pala.
Uh,
Divergent channel naman tayo of the pericardium.
so it ascends across the throat and emerges behind the ear, communicates in the upper, middle, and lower jaw.
Okay. The function of the pericardium divergent channel.
It reinforces pericardium and sangao relationship, connecting to the neck and to the mastoid, allowing pericardium channel to treat some varieties of neck pain. It distributes to the sides of the chest and hypochondrium, explaining the ability to treat those areas. It treats plumpit cheese syndrome.
Oh,
There.
can you relate to that? Plum pit?
No. I I think
You can
before.
feel something, parang there's something in your throat, but there's
Oh
none.
yeah, there's something in the throat. Yung parang
You're
may
about to have
naka-stuck. Yeah.
pathology of the pericardium. Ay, hello, Sir Joel, Mr. Cadiz. Okay. Mamaya, sagot ka sa sa pulse. Now, the external pathway of the pericardium meridian of Jue Yin surfaces at which anatomical landmark?
At the fourth intercostal space lateral to the nipple.
The pericardium meridian of the Jue Yin travels along which side of the biceps?
At the center.
Which meridian travels along the lateral side of the biceps brachii tendon on the transverse cubital crease?
The long meridian.
Now, you understand why malungkot ka na, nasisiraan ka ng bait. Diba? Okay. Kaya wag na malungkot.
Yes, let it go.
Life's short. Enjoy life. The pericardium meridian of the Jue Yin travels between which metacarpal bones?
The second and third metacarpal.
Which, multiple choice, which point is the meeting point for the three yin meridians of the hand?
Letter B, the Jing River point of the Hanjuyin meridian.
Okay. Jue Yin is the pericardium meridian. The Jing River point is pericardium 5. What is the linkage of the pericardium channel?
Arises from the palm at the Laogong, PC8, and follows the ulnar aspect of the ring finger to its tip.
Okay, pericardium 8 to
That's
Sanja 1.
the one.
How are the pericardium and stomach paired? Oh, kaya pala, di ba? Like, did you know that if you have issues with the stomach, like you can use the pericardium? Remember PC6? So effective, especially when you have GERD, gastric pain. Okay. How are they
So,
paired?
if they're the pericardium distributes chi and regulates the function of the stomach and the diaphragm.
Actually, they're so close. Yeah.
Like,
Kaya when you're ano ba? Some you can actually use the pericardium channel to treat stomach issues. What are the pathologies of the pericardium luo channel? Both the shu and the shi.
so
Kanina
for
sabi
excess,
ko,
it's
paulit-ulit.
chest pain for excess, and then for deficiency, it's stiffness of the neck, head and neck, a protective mechanism to keep heat and wind from getting into the head.
Did you ever experience the pericardium excess?
No, haven't.
Ay, denial. Okay. What are the binding sites of the pericardium sinew channel?
Elbow, axilla, and diaphragm.
Okay. It originates tip of middle finger, yeah, elbow, axilla, and diaphragm. Pathologies of the PC sinew channel.
Um, strained and cramping sensation along the course of the channel, pain in the chest with urgent breathing, and an inverted cup sensation. below the lower right ribs.
Okay, expectedly, when you have sinew channel issues, you will expect cramping, no? Anything that, straining, cramping, muscle strain. What is the pathway of the pericardium divergent channel?
Separates from the primary channel at a point 3 inferior to the axilla. It enters the chest and communicates with the three jaws. A branch ascends across the throat and emerges behind the ear to converge with the Sanjiao channel.
Okay. What are the functions of the PC divergent channel?
Reinforces pericardium and Sanjiao relationship connecting to the neck and the mastoid, allowing pericardium channel to treat some varieties of neck pain. Distributes to the sides of the chest and hypochondrium, explaining the ability to treat those areas.
So actually, it's more
Lung
on channel issues, not the organ, diba? What are the two branches and their pathway of the liver primary channel? So there are two branches of the liver primary channel.
uh, descends from the eye system through the cheek and encircles the inner surface of the lips. And then the other one is separates from the liver, crosses the diaphragm, and spreads in the lung, meeting with the pericardium one.
Okay. Which Zhang Fu does the liver channel connect with? There are four of them.
Liver, gallbladder, the lung, and the stomach.
Okay. Ang daming involved, no?
Yes.
Yeah. So, yun. Where is the Lu connecting channel of the liver channel?
Liver 5.
Okay. Where does the liver luo connecting channel arise from and flow to? Kasasabi mo lang liver 5. And where does it
Liver 5.
flow to?
So from liver 5, separates from liver 5 on the medial aspect of the lower leg, connects with the gallbladder channel and then ascends to the genitals.
Okay. It flows to the external, yeah. That's
External.
to the external genitalia. Where is the divergent channel of the liver channel?
Starts at liver 1, separates from the primary channel on the dorsum of the foot, ascends to the pubic region, where it converges with the gallbladder primary channel.
The liver sinew channel originates on the dorsum of the big toe, ascends to the anterior aspect of the medial malleolus, proceeds along the medial aspect of the tibia to bind at the medial condyle. Where does it go from here?
So from there, it continues upward along the medial aspect of the
Nakikiliti.
that one,
Okay.
to the genitals where it connects with the other senior channel.
Iba yung kiliti. Okay, sige. Where does the liver divergent channel originate, emerge? And which organs does it connect with?
Originates on the foot, emerges on the eye,
Yeah.
and yeah,
The organs?
the organs are the liver and the gallbladder.
Yes. Which Zangfu does the liver primary channel connect with? I think you answered this earlier now.
Yeah, liver, gallbladder, lung, and stomach.
Actually, this is important, no? Like, if you have issue with the liver primary channel, then you would know uh, the organs that are affected, no? What is the entry and exit points of the liver channel?
The entry is the liver 1. The exit is the liver 14.
Liver channel, primary channel pathologies.
Pathologies. Low back pain,
Hmm?
fullness in the chest, pain in the lower abdomen, hernia, vertical headache, dryness of throat, hiccups, enuresis, dysuria, mental disturbance.
O, di ba? Mental disturbance. Last
Mhm.
one. Okay. The liver primary channel Zangfu that is entered again, paulit-ulit. I think this is the third time.
Liver, gallbladder, the lung, and the stomach.
Okay, liver primary channel crossing points.
Spleen 6, spleen 12, spleen 13, Ren 2, Ren 3, Ren 4, pericardium 1, and do 20.
Okay, discuss the liver loop connecting channel pathway. Where does it
Uh,
separate from?
Separates from the primary at the liver 5 on the medial aspect of the lower leg, connects with the gallbladder channel, and then ascends to the genitals.
Yes, you just remember this. Okay,
Okay.
liver divergent channel pathway.
Separates from the primary channel on the dorsum of the foot and then ascends to the pubic region where it converges with the gallbladder primary channel.
Liver sinew channel binding sites.
The anterior aspect of the medial malleolus and medial condyle.
Liver 1, point categories.
It's the Jing well or the wood point.
Liver 2.
The Ying spring or fire point.
Liver 3.
The shoestring Yuan source. It's the earth or the Ma Danyang, the heavenly star.
Liver 4.
Jing river and the metal
Liver 5.
is the Luo connecting.
She-cleft point of the liver channel.
Liver 6.
She-cleft point of the pericardium channel.
There, wait. Liver 6.
Pericardium. Pericardium.
Oh, wait. Where is it? Wait, number.
CC
71. I said liver
Liver.
6. Sorry, liver
No, no,
6.
no. The pericardium channel. It's
Ah,
C4. Kasi di ba, you
CC.
remember, when you do Aculift, you needle
CC.
pericardium. Yeah, pericardium 4 and liver 8. No, sorry. Pericardium 4 and Sanjiao 8. No? Pericardium 4 is, yeah,
4 is the sweetless.
yeah, she-cleft. Needle mo yan, hindi masakit sa mukha. Pericardium 4 and Sanjiao 8. So for the liver, it's liver 6. Liver 7, point categories.
None.
None. Hindi ko nga alam na exist yan. Liver 8, point categories.
The Hosi Point, water, and the mother.
Liver 9, point category.
None.
Liver 13, point categories.
It's the front mu point of the spleen, the hue meeting point of the zang.
Yeah, way meeting point of the Zang. What is the
Wait.
way meeting point of the Zang? Inulit lang.
Liver 13.
Liver 13, cautions and contraindications.
Enlarged liver or spleen.
Liver 14, point category.
Front mu point of the liver.
Liver 14, cautions and contraindications.
Pneumothorax.
Yeah, malapit na sa lungs yan. Which liver channel points alleviate pain?
Liver 1.
Yeah. Yes. So, hindi masyado si liver 6. Although, in theory, si liver 6 dapat kasi she-cleft siya. I think liver 6 is more into the blood issue of the liver. Which liver channel point clears the heat?
Liver 2.
Which liver channel point calms the spirit?
Liver 1.
Which liver channel points regulate the chi?
Liver 5, 13, and 14.
Which liver channel point relaxes the sinews?
Liver 7.
Yeah. Which liver channel points invigorate blood?
Liver 8 and 14.
Okay, liver 8 is the what? The Jose point? The tonifying point, right?
25.
Yeah, tonifying siya, di ba? Liver
25.
14 is the front move of the liver. Which liver channel points benefit the uterus?
Liver 8 and 11.
Yes. Which liver channel point benefits the knees?
Liver 7.
Which liver channel point clears damp heat from the lower jaw?
Liver 8.
Which liver channel point nourishes blood?
Liver 8.
Which liver channel point nourishes liver blood?
Liver 3.
Yes. Which liver channel point nourishes yin?
Liver 8.
Which liver channel points benefit the genitals?
Liver 1, 5, and 8.
Which liver channel points benefit or regulate the lower jaw? Let's start with the lower jaw first.
Liver 2, liver 10, and liver 12. And then regulate the lower jaw. It's liver 3, 4, 6, 9, and 13.
Which liver channel point extinguishes wind?
Liver 3.
Which liver channel point regulates blood? Oh, ito na yung sinabi ko kanina.
Yeah.
Yeah.
Liver 6.
Yeah, so parang when it comes to
Right.
pain, I think liver 1 is more effective. No? So, yun. Especially when you have cirrhosis siguro, yung mga portal
Yeah,
hypertension.
para mabilis.
Yeah. Alleviate.
Liver.
Which liver channel point regulates middle jaw?
Liver 6. I'm
No,
sorry, liver
liver
13.
13. Sino si liver 13? What is the category of liver 13? It is the front of the
Front of the...
ano ba yung pinaka-importanteng role player sa middle jaw? The spleen, right? Liver 3, spleen. Liver 14. Liver 13 is front mo of the spleen. 14 is the front mo of the liver. Which liver channel point regulates qi in the lower jaw?
Liver 1.
Which liver channel points adjust or regulate menstruation?
Liver 9. And adjust liver 9. And then regulates liver 3 and 5.
Wow. Okay. Which
Right.
liver channel point revives consciousness?
Yeah, liver 1.
Why? Kasi Jingwell siya, diba?
Well, yes.
Wow. Which liver channel point stops bleeding?
Liver 2.
Gali? Which liver channel point adjusts urination?
Liver 1.
Which liver channel point clears damp heat?
Liver 10.
Which clears damp heat from the lower jaw?
Liver 5.
Which liver channel point clears damp heat?
3.
Which liver channel point clears the eyes?
Liver... Liver 3.
Yeah. Itatry ko
There's
kaya
the eye.
liver 3. Tutusok-tusokin. Which liver channel point clears heat from the lower jaw? Ay, naulit.
5.
Yeah, 5.
Oh,
Which liver channel point clears liver channel stagnant heat?
4. Liver 4.
Which liver channel point clears liver fire?
Liver 2.
Which liver channel point disperses masses?
Liver 14.
Which liver channel point eliminates cold from the liver channel?
Liver 12.
Which liver channel point harmonizes liver and spleen?
Liver 13.
Talagang partner sila parate. Napansin mo? Which liver channel point harmonizes? Oh, I love this number, 111. Which liver channel? Which liver?
Team. Which liver?
Liver and spleen.
Liver
Liver 13. Liver and stomach.
14.
Yes. Thank you so much for
Thank you,
joining.
Dom.
And perfect talaga. Grabe. Memorize mo na yung Jué Yīn.
Hindi.
See you again next time. Thank you tayo sandali. Thank you.